Hello, good afternoon, good morning, good evening. Hello from this side of the world, wherever it is you're watching from and whatever time it is. Thank you for being here. Please let me know if you can hear me. You can't see me. I'm the voice that you're going to be hearing during this stream. So let me know if you can hear me. Please let me know in the chat if you can hear me. And please let us know where you're watching from. Please introduce yourself in the chat. Okay, let's see, who do we have here? Welcome, okay, guys. Okay, I see you, peace. I see you, peace. Welcome. I see Hope watching from Lagos. Welcome. I see Aderonke from Lagos. Welcome. I see you all. Please let me know if you can hear me in the chat. Ooh, we have Gift watching from Lagos. Thank you all for being here. Who else do we have here? I think I see Joy watching from Finland. Yes, yes, yes. Ooh, thank you. Oh, okay. I got a reply there. Yes, you can hear me. All right. Okay, that's so lovely. That's nice. We are going to get started in a second. So I just want to remind us why we are gathered here today. Sorry. Ooh, bad manners. I forgot to introduce myself. So Sherry Oha is the name, and I'm going to be the moderator and anchor of today's section. I'm not very important, so you're not going to be seeing my face. Although I wanted to show you my face, but too bad I won't be able to. But I'm not the reason why we're gathered here today. We're gathered here today because we're celebrating World Diabetes Day. I mean, it happened. It's not like it happened today. It happened on the 14th. But then we decided as a brand, Coco's Mill City, decided that we were going to do something to celebrate the day. Last year we had a physical event, but this year, we decided to make it virtual so that everyone can join in from all over the world. Coco City, at Coco City, we're very passionate about um, creating awareness, about diabetes and just letting people know that it is not a death sentence. Like, you can still live your life, you can still eat yummy, healthy food, but there are some things you need to do, and it's about lifestyle modification, taking your medication, going for your checkups, and all of those things. So there's so many things about diabetes and words on the streets. Honestly, please let me know in the comment section. Words on the streets, right? There's just so many myths and so many things that are not true. And we are here today to debunk those myths and let you know what is the truth and what you can do about it. So you're going to leave here feeling empowered, whether you are the one who is living with diabetes, or you have to take care of a loved one, or you're just learning because you want to prevent it. Whatever stage you are, whatever category you fall into, there's something here for you. Now, in a second, or maybe give me like 5 seconds, I'm going to bring in up our first speaker. Okay, so I am going to please the chat. You can keep it. The chat is live. Yes, I forgot to mention that the chat is live. But the presentations, they are pre-recorded, and the reason why we pre-recorded them was because our guest experts, our speakers, they are busy people. They're experts and living their lives. Doctors, pharmacists, the nutritionists, and some of them might not have been available to go live with us today, but we said, you know what, just do a recording for us. We'll still play it and still have the live feel and still learn, and we don't have to worry about network not being available. We will still have like all the goodness and learn everything that we need to learn all the same. So the videos will be pre-recorded, but I'm live here with you because I can see you all in the chat, right? uh, but the sections is pre-recorded, but the chat is live, and at some point the speakers are going to be in the chat and they'll be able to answer your questions. So if you have questions during the sections, please feel free to drop it in the chat. I will also be in the chat, and pharmacist Esther will also be in the chat at some point. Okay, so please keep the chat popping, and you can drop, like, if there's something that was said and you really liked it, you can just drop it again. There's some time at some point where you have questions and stuff, just drop all of them in the chat. The chat is live. Okay, so are we ready? Because I'm about to bring up our first speaker. All right, but before then, I think I want to do a quick test. Um, from the on the let's say on the scale of 1 to 10, how much do you know about diabetes? Like on the scale of 1 to 10, if I say, okay, rate yourself, what would it be? How much information do you know about diabetes? On a rate of 1 to 10, 10 being that you know so much about it, like you know everything. Maybe you studied medicine, you're a doctor, you're a professional or something, and you know everything about it. Or maybe you've been taking care of a loved one for a very long time and you kind of like know everything about it, but then again, that's everything about it. Yeah, I get that to be, but no problem. Then one is that you don't know so much, and then that eight that you're somewhere there. Five is that you're somewhere in the middle, yeah, kind of. Two from below five is that you don't really know so much, you just know average, and then five is that okay, you're okay, okay. Six, you're somewhere there. So let's know what, like, rate yourself. How much do you know your knowledge about diabetes? Was it so the chat? I think there'll be like few seconds delay, but yeah, you be
Privileged
able
to be
to. I should be able to see it in a second. Okay, so I can you hear me? Are you writing? Are you typing? Are you typing? Are you typing? Are you rating yourself? So 5, 4, 3, 2, 1, 8, 10. Yeah. Okay. I'm trying to get a second here. Um, all right. So while we do that, I have a six. Oh, I have a six. Let's see. I have a six. That's me. Okay, okay. Uh, I have a six here. All right. Okay. So you do know quite a lot. All right. Okay. While the rest come in, um, we are going to take our first speaker. So, Amaka, we see you. Good afternoon, everyone. Good afternoon. Right back at you. Welcome, welcome, welcome. And we are getting this show on the road. All right. So, before I bring our first speaker, I just want to read his short bio. He's Dr. Jeffrey Femi. I avoided the surname because I don't want to pronounce it wrongly. Okay, and he's a medical officer with Primary Health Care Board, and he is going to be telling us today about diabetes. Right, he's going to be giving us in USA 411. He's going to be giving us like all the gist about diabetes, the myths, right? The misconceptions, those things that are not true. Remember, we said that at the beginning that there's so much words on street, there's just so many misconceptions, and most of them are not true. So he's going to be telling us the things that are not true. Then he's going to be telling us the truth, the real thing that we need to know and understand about diabetes, and then how to live and how to manage the disease and how to live with the disease, that if you have been diagnosed, okay, it's going to be a very interesting section. So right now I'm going to get out of the way, and the next person you're going to see is our first speaker. So you can help me clap in the chat. So ladies and gentlemen, Dr. Jeffrey, as he takes the stage.
Day, nice to be here. My name is Dr. Jeffrey, and it's a privilege to be taking you on this little short discourse. Well, I won't call it discourse because I won't be taking any opinion right now. So let us just call it a public announcement in which, if you have any questions or query afterwards, you know the right channel to talk to for us to have a discourse. Yes, I'll be taking the myths and the misconception most of us have with respect to diabetes. Well, because diabetes affects a lot of people, about 450 million people worldwide is living with the disease. So one way or the other, we either know somebody that has it or we are close to the person. Because of the fact that a lot of these cases go undiagnosed, we need to keep in check and do a regular checkup for us to be able to know. But without wasting much time, let's just dive into the topic. The myths, misconception, common ones that we have, that we need to clear off our mind. Although diabetes is a familiar word and the symptoms varies, that's the problem about it. We think we know it, but it's more complex than that. So diabetes is both simple and complex. Unfortunately, because of this falsehood that people believe about it, myths, it creates a lot of problem. So first, we need to clear up the myths, then be able to focus, especially when we are having issues with it. Like we have somebody very close to us that is coming down with such illness. The first thing that people think about diabetes is that is when you eat sugar that you have diabetes. That's a big fat lie. Although sugar is related to diabetes, but not in the way we think about it. First, diabetes is of two kinds. We have insipidus and mellitus. Diabetes insipidus does not have anything to do with sugar at all. It has to do with salt and water. The other one, that is mellitus, is the one that deals with sugar, but not directly the way we are thinking about it. It's not by consuming sugar that you have diabetes mellitus. It's either your body is having problem breaking down sugar, and which can be of two types. Is that the enzyme that your body is producing to break down sugar is not enough or not present at all. So that is diabetes mellitus. Breakdown of sugar, not eating sugar. That would happen in your system. And it is because of this enzyme called insulin in your system. So though sugar is related, it is not that direct. Another thing that people say with respect to diabetes is diabetes is not serious. The people will live with it. You can do anything you like. Nothing is going to happen. Please, diabetes is a very serious problem. It's very common. And if it is not managed well, it can cause a lot of complication. It can cause skin problem. It can cause hearing impairment. It can cause kidney damage. It can even cause cardiovascular disease like stroke. One of the things that most people complain about that should lead you to start evaluating them for diabetes is the fact that they will start saying that they cannot feel with their hands or with their feet. That is nerve damage. Sometimes it will give a kind of numbness that we call paja, or you would not be able to feel any sensation. In fact, the person may even be walking on hot substance and not feel the pain. Those are kind of complication that comes with diabetes. Please, if you have someone close to you that have that feel, kindly take them to the hospital for evaluation. Diabetes is a serious problem that can even lead to amputation of one's limb. When I mean limb, leg or hand can go because of it. Another misconception that people have with respect to diabetes is that the symptoms are obvious. You will see every signs and symptoms with respect to diabetes. My brother, my sister, diabetes does not have symptoms that you can see. Sometimes you will not see it. It can be mild and easily go unnoticed until you start having those complications. So that is why it is good for you to go for general check-up. Once in a while, say every 6 months. If it's too expensive, every year. You can even do the least amount of tests that would involve you not eating in the morning by 8 a.m. If you like food so much, 8 a.m., go to the clinic, carry your food along, let them test your sugar. That is enough. When you start having symptoms like excessive thirst, excessive hunger, excessive urination, blurred vision, numbness, and tingling sensation in the hand, fatigue, cut, and wound that does not heal, it is already a complication. Please, that is why it is important for you to do a checkup once in a while. 6 months, latest a year. And this it's not limited to old people, young people like us in our 20s, in our 30s. Please. Another thing that with misconception that people think is that is if you are big, if you are overweight, and when you do your weight, you're not getting your body mass index going to like 25, 26, up to 40. That is when you have diabetes. That is a big lie, a big fat lie. While research shows that those that are overweight who are not physically active are more likely to have diabetes. Other personal life or lifestyle factor can increase one's risk. If you are, our skin, if you are dark skin like me, it is most likely you are more likely to have diabetes. If any one of your siblings, your mom, dad, sister, or brother have diabetes, you can have it too. Age more than 45 is also a risk factor. So we should be on the lookout. Another thing that people say is that diabetes can be cured. Well, right now, as I'm standing here, as I'm speaking to you, if you have the cure to diabetes, please come out. Let's do tests on it. Let's test your medication if it is safe for people to take that will not kill them. You know that it can be a cure when the drug kills the person, and you have ended up ending the person's problem by killing the person. That's not what we are saying. If your drug is a safe drug and we can bring it out, you can bring it out, test it on subjects, and it works. Bring it out. You will be happy in the medical field to test out your drug to see if it works fine. But at this moment, there is no drug that cures diabetes. It can be managed. Yes, I've seen a lot of people. One of my mentors that really had a profound effect in me with respect to medical field has been living with diabetes for the past 50, 60, up to 60 years. And he's managing it well and he's doing fine. So if you can, if you have, please, we can manage it and we'll be able to take care of it. Most of this concussion or whatever solution that is being done that is said to take care of diabetes really cause a lot of complications with respect to it. The funny part of it is that most people don't realize that the medication you use, the drugs, orthodox medicine, tests are run on it to see the dose that is going to affect you. And test is also run on it to see the dose that will do the necessary required good in your system. So those ones, the dose that is going to cause problem, we don't give it out. But the dose that is going to take care of the problem and how long you are going to use it for is there. If you buy a medication, you will see a kind of instruction that follow it through. Some of the instructions inside medications is even bigger than some of the books that some of us read. If you take time to read them, and then we'll be able to know how to manage it. So this is one of the misconceptions, that it can't be cured. It can only be managed. Another thing that people say is that when you have diabetes, you should not drive. You cannot be driving car since diabetes affects the eyes. No. Once it is managed well, once you take the necessary tests, you can't be cleared to do all duties that anyone does. Most people that live with diabetes operate vehicles, they operate machines, and they are able to do things that other people do. So please, that misconception of the fact that if you have diabetes, your life has ended. It is not. There are ways that you can manage all this. And this is also linked with the next one that says if you have diabetes, you can't be active. You are already an old person. You don't. No. Among other things that you can do to manage diabetes, exercising helps to drive in the point. All the risk factors that comes with it. When you do exercise appropriate to you, you will be able to, with the medications you are giving, reduce the risk and reduce your blood pressure. It will even help your body to use the drug better, even help your body to produce more insulin. So things that we need to do is, if we have that already, check our blood sugar while exercising, keep a record of how it behaves and show the doctor. What do I mean by record of how it behaves and show the doctor? You check it in the morning, this level, check it in the afternoon, this level, check it in the night, this level. Write it down. Your clinic days, maybe like in the next 2 weeks. If you have that written down, you have it written down already, and you show it to the doctor, that this is the reason of my sugar for the past 2 weeks, so I've been doing it. The doctor will be impressed, because it means you value your life, and the doctor will be able to give you even more information that he might feel reluctant to give, because most people don't listen to instructions. So now, if you are thought that you are at risk of the sugar being too low, instructions will be given, and then you'll be able to follow through, and you'll be able to live your life to the full. The last misconception that I've talked about is the fact that you can catch diabetes. My brother, my sister, diabetes is not a communicable disease, so you can't catch diabetes. It cannot be passed from somebody to another person, just like malaria, just like infection, just like Ebola. It's a non-communicable disease. So lifestyle, in fact, I call it the product of nurture and nature. Nature being what you inherit from your parents, your ancestor. Nurture is how you take care of yourself. So if you have high risk of having diabetes and you are not living an healthy life, you are going to It's going to lead you straight into diabetes because you have the predisposition to having it. So that is the last myth we'll be discussing. Because of the fact that the burden of taking care of this illness is high. For someone that has been diagnosed diabetic, you'll be required to go to your clinic to see your doctor. At least the appointment will start with probably when they discover that you have diabetes. If the fact that you have to be admitted to the hospital to correct the sugar, you say, okay, I give you 1 week appointment, use this drug, use that drug. Okay, next they will increase it to 2 weeks, 4 weeks. If you have a relapse, it will start all over again. That can be burdensome, very burdensome. But what can you do in order for you to prevent yourself from having such burden? Because you are not the only one that is going to be affected, though. The person that will take you to the hospital also will be disrupted. And at that point in time, you are seeking medical care. The quality of life is reduced. The cost of living is increased, especially in this time that it is not easy to get money and there are a lot of responsibilities. So what can you do? How can you help yourself? The first thing you need to do is to have a discussion with your medical practitioner, the doctor taking care of you, the nurse taking care of you, the healthcare management, and let them tell you, let them discuss everything that is involved in your treatment. Because to tell the truth is, there is no patient, a patient you have now cannot be identical to the next one. So you as an individual, sit down, discuss with your medical practitioner, tell you how you are going to manage this illness, what is expected of you to do, and how you are supposed to do it. If it is forgetfulness, let them help you write some instruction. Paste it in a public place in your house. And from there, you will start up. You can manage your sugar to the extent that you'll be seeing your physician once in 6 months. And if you take permission from work to go and see your physician once in 6 months, I don't think anybody would be so how should I put it, would be so against you feeling better that would not give you that opportunity. So that is where you should start from. Speak with your physician. Table down what you need to do. And then from there, you will start getting good health care. So when we start with that, every other thing surrounding your treatment will come along and they will form a shape. And the second thing is that you have to have a positive outlook. A lot of diabetics do well, hold places of responsibility, go for seminars out of the country, out of their state. But you need to have a positive outlook and have a good relationship with your medical practitioner, the person taking care of you. That will be the start of you getting better with respect to diabetes. Thank you very much for the time.
Okay, how was that section? All right, so now I want you to help me do something. Please say a big thank you to Dr. Jeffrey in the comment section. Just say thank you, thank you, thank you, thank you, thank you, thank you, thank you. And yes, please drop a fire emoji if you learned something from this section. Fire emoji. Oh yeah, oh yeah, oh yeah, drop it, drop it, drop it. I'm seeing some fire emoji. Yeah, let's see. Drop fire emoji. Then say thank you, thank you, thank you, thank you. Say thank you, thank you, thank you, thank you. I want to say thank you, thank you, thank you. And also let me know what stood out for you from this section. I know some people know one or a thing or two about diabetes already, but what was the thing that stood out for you from this section? Yeah, so I see the fire emojis, I see some thumbs up, I see some thank yous. Yes, we're going to send your regards to Dr. Jeffrey. So yeah, drop them in the comment section. Okay, okay. Yo, yeah, I love this energy. Yes, thank you, thank you, thank you, thank you, thank you, everyone. Thank you. Okay. All right. All right. Okay. Yes. Yes. I see all of them and I'm putting them here. Okay. So now in the chat, please quickly let me know what stood out for you. What's the new thing that you learned? All right. And we are moving on. This show, we're taking it on the road. Okay. And we are moving to the next section. But before then, in case you have any question, all right, I want you to put it in the chat. Okay, if you have any question, any concern regarding what he has said, you can put in the chat. Truth is that we have so many doctors in the comment section. We have doctors, we have pharmacists, we have people in the comment section. So if you have question, put it in, and I think I might take maybe one or two. We're gonna have question and answer time.
Afternoon,
Sorry,
everybody. Yes,
sorry. Yes, that's our next speaker. But before that, yes, it's me and you having a really good time. Okay, so if you have any question, you can put it in the chat for me. And if you don't have any question, actually, this show, we can take it on the road. All right. So, do we have any questions? Did you learn anything? And I want you to write what stood out for you or one key takeaway from this section. I want you to help me put it in the chat. All right. So, like I said, we are taking this event to the next level. We are moving forward, ahead, ahead, ahead. And right now, we're going to be taking our second speaker. Okay. And like we said, we brought experts. I'm going to read his short bio. Okay. He is an endocrinologist that's passionate about diabetic care. Okay. So I know a lot of people will know what an endocrinologist is, but just in case you don't, I'm trying to explain it in the best words that I can. So, an endocrinologist is a doctor, but he's a specialist at endocrines, yeah, like so hormones and all of those things, and insulin happens to be, part of them. And yes, so he is a specialist at this, yeah, and he's going to be talking to us about the effects of poorly managed diabetes. So we're going to be hearing about the complications. So if you don't manage this disease properly, there are consequences, and you're going to be hearing about them. The consequences, like complications. Okay, so you're going to be hearing about them in a second. All right. So, ladies and gentlemen, let's try this now in the comment section. Now, I know the comment section has like 10 seconds delay, but I want you to help me clap, a round of applause. Yeah, or you can drum roll, please. Anyone can use any of the emojis. All right, as I introduce and I bring up to the stage our next speaker, who's going to be talking to us about the effects of poorly managed diabetes and the complications of diabetes. Okay, so he's Dr. Ibi Dapo. Yeah, and the best name that I can pronounce here is actually Dr. Raphael. Okay, so ladies and gentlemen, a warm welcome. I've not started seeing the claps, so I'm not started seeing the claps, but I know it's going to come in a second. So I'm going to just move myself out and then bring him to the stage. Like I said, this section is pre recorded, but the chat is live. So feel free to drop your questions and drop your comments. All right. And I'll also be in the chat with you. And your questions will be taken during the next break where you see me. So, ladies and gentlemen, our next speaker.
Good afternoon, everybody. It's a pleasure to be here and to give me this opportunity to bring at least one or two things, to say one or two things concerning diabetes. I'm an endocrinologist and my name is Dr. Ebidako. Okay, so I'll just discuss one or two things concerning the consequences of poor diabetes control. We all know what diabetes is. Just for the sake of those who are new to the topic of diabetes, diabetes is a chronic medical condition, is a metabolic disorder of glucose, protein, and fats metabolism that is characterized by hyperglycemia as a result of either absolute insulin deficiency or a relative insulin deficiency. Okay, so basically what we are saying is you have high blood glucose because the insulin is not available, or it is available and it is not doing what it's supposed to do. So I'll just go straight into what are the consequences of diabetes, particularly when it is not properly managed. We all know that the incidence of diabetes is increasing worldwide, and Nigeria is not spared at all from the effects. Okay, so now the consequences are divided into basically two. Again, we are looking at those that can affect the small vessels of the body and those that can affect the large vessels in the body. But let me also stress that diabetes affects every part of the body. No part of the body is spared from the effect of diabetes. So when we are talking about the consequences of diabetes, is virtually every part of the body is involved. But for the sake of this discussion, we'll just put it into those that can affect the small vessels in the body and those that can affect the large vessels in the body. So for those that can affect the small vessels in the body, basically we are looking at the nerves, okay, the kidneys, and then we're looking at the eyes. So we are looking at again the eyes, the kidneys, and the nerves. So for the effect on the eyes, it can cause glaucoma, it can cause cataract, it can affect the retina. In fact, it is one of the commonest causes of blindness worldwide. So it's something to be taken with all seriousness. And that speaks to the need to control our glucose very well. The other important cause, like we mentioned, is the effect on the kidneys. So for patients who have diabetes, one of the things they notice is that they sometimes also urinate and their urine is foamy. So once their urine is foamy, that may mean that they are leaking out proteins, and proteins are very bad and toxic to the kidneys. Okay, so one of the effects of high glucose is the effect on the kidneys. It can damage the filtering barriers in the kidneys and pose a lot of danger to the person. Now, the other important one is the one we talk about, the effect on the nerves. Okay, so that may present with numbness in the hands or feet. It can also come with sometimes tingling sensations, burning sensations. Particularly, patients will say that whenever they sleep, they can't even sleep because of the burning sensation. Some people even wake up with burning sensations or tingling sensations in their feet. So that may also mean damage to their nerves, which is one of the commonest complications that we see in the clinic. So again, it can be very disturbing and very difficult to manage. So again, it's best managed when your glucose control is very good. So that is it helps it a lot, regardless of whether you're being given medications or not. Okay, so we also now look at the big vessels now, the effect on the big vessels. Number one, it could affect the vessel of the brain and cause stroke. Okay, and we know the effect of stroke in the body. It can be very debilitating. It can also cause dementia. It can also cause a lot of brain damages. Okay, so that's one of the big vessels effects on the brain. The other one is the effect on the heart. So it can lead to heart failure, damage to the heart, causing it to fail. Another important thing is also it can cause heart attack in the heart, kind of from the blockage of the vessels in the heart. Okay. Another important complications of it is the effect on the vessels in the legs. So it can cause a blockage in the vessels in the leg, the big vessels in the leg. And that's what we call the peripheral arterial disease, where it's most patients will complain of pain while they walk. So if they are walking, they have pains at the back of their legs. Sometimes they will have to rest for the pain to wane down, and some as they begin to walk again, they experience that pain. Now, another important consequence of poor glucose is ulcers, amputation of the leg. This is a very, very important complication because diabetes is responsible for the is about the commonest cause of non-traumatic amputation worldwide. So it's something that one needs to take very seriously for those who have diabetes, and it is actually a consequence of both the large vessel effect and also the small vessel effect, particularly the neuropathy and the effect on the big vessels. So that may affect the limbs and cause one to lose the limbs if care is not taken. Another important effect that we must also discuss is the psychological effect that diabetes also poses, which is can come with depression. So for those who have diabetes, depression could be a major thing, because having to deal with a chronic illness and having to live with diabetes day in day out, it could take some psychological toll on the patient. Now let's look at the management. How do we prevent some of these consequences or complications of diabetes? Number one is through good lifestyle changes. So our diet, eating healthy, physical activity, those things are very, very important when it comes to managing diabetes. Beyond the medications, those play a very big role. when it comes to managing diabetes. Um, Again, it's also important to state that there are targeted goals for those who have diabetes. It's best when you keep your readings very, very strict. Once you keep them strict in the acceptable range, then the risk of running into those complications will reduce. And even if you have the complications, our aim is to ensure that the complications do not progress. So, and the best way to do that is ensuring that the glucose control is optimal. And those are important things to consider, particularly your numbers. We talk about know your numbers, the blood pressure being kept at a very good range, your blood cholesterol level also being kept at a very good range. So those are important things that one must look into when you want to prevent some of these complications. Okay. Again, it's also important for me to state that for foot ulcers, the best way to prevent them is to ensure that you put on your shoes or wear something very protective whenever you are at home. Okay, and ensure that you clean your foot every day, clean them properly. Ensure that before you wear any shoe, you check the inside of the shoes and ensure that there are no sharp objects that can cause you harm before putting it on. Another important thing is avoid cutting your nails with sharp objects. One, you could use a nail file instead. So those are ways that you can help prevent any injury to the foot, which may result into an ulcer and ultimately um, an amputation of the leg. Okay. Now for the kidneys, I think the important thing to help in that regard is taking a lot of water and then avoiding drugs that can damage the kidneys. Buying over-the-counter drugs, pain-relieving drugs that can damage the kidney is a very important thing to look into. Most of us use all these over-the-counter medications carelessly, but it's not really the best. And then I also talked about drinking water. It's very important that we take adequate water, especially when the weather is very, very harsh. I mean, very hot. We need to hydrate ourselves properly. Okay. Just again to look at the way you prevent your eyes, complications from the eyes. Is expected that for everyone that has diabetes, that you visit your eye doctor at least once a year, and once you notice any symptom of blurry vision or double vision or um, any form of pain in the eye, redness in the eye, that should prompt you to see your doctor and have the eye looked into. Okay. Well, those are the little complications that can come in when diabetes is not properly managed. Okay. I think we've talked about how it can be prevented. Um, Everything still boils down to good lifestyle changes and good medication use. Okay, to be regular with your medications. Like I always say, diabetes is a dynamic disease. What that means is dynamic and is also progressive. It can be is a progressive disease. So if you're using a particular medication, sometimes that medication may not be the only medication that will help in controlling the diabetes. It may need to be added, and some medications may need to be added, and some may need to be removed depending on the state of your diabetes. So thank you once again for giving me the opportunity to just say one or two things with the celebration of this Diabetes Day.
All right, please appreciate this. A round of applause. A round of applause in the comment section and drop a fire emoji if you learned something, and then say a big thank you to Dr. Ibidapo. He did an amazing job and just talking about the complications of diabetes. So, in a nutshell, while I wait for your claps and your thank yous, all of them popping up, I yes, please. I just want to go over some of the points that he made. That diabetes is a systemic disease. It affects the something that can affect the whole body. So it's not just about insulin, your body being resistant to insulin and all of those things. That's if it's type 2. But excuse me, it's understanding that, oh, this thing is something that can affect the whole of my body. It can affect my eyes, can affect my blood vessels, can affect my nerves, you know. It's affecting literally every part of my body, right? It can affect every part of my body. So it's important that you are taking your medications, the lifestyle modification, and the next section is actually about medications. Yes, we have our pharmacist coming up next. Yeah, so understanding that, oh, when I decide not to be compliant with my medication, I am actually causing trouble. Okay, because this thing is not just as simple as it sounds. There's more to it, and the complications. It could be bad sometimes when it happens, and you don't want to get there. We don't want to get to the point where it has affected your kidneys and now they're shutting down. There are people who it leads to, like, they have to be on dialysis, and people, they're getting amputated, their limbs getting amputated, maybe their legs or even their hands. Mostly we have like the leg situations because you know we here on this side of the world, we should be wearing more slippers, sha, but then in the house, you walk around bare feet and all, not realizing that, oh, a little cut could make a difference because now there's slow healing because of the whole insulin situation. So you see, it's not that simple. And this is why we are gathered here. We came to learn because the complications, especially that part, it's not, I don't know, there's words on the streets, but that part is not very loud. I mean, doctors are saying it. It's just that everybody needs to listen more. Yeah, and this is why we're doing what we're doing. So, in the chat, please let me know, what did you learn? Oh, okay. I'm seeing all the thank yous. All right. Thank you. Yes. Thank you. Oh, y'all keep it coming. Thank you. I'm seeing great delivery. I'm seeing a round of applause. More clouds. More fire. Yes. Thumbs up. I love it. I love it. The chat has like a 10 seconds delay, but trust me, I can see it. Okay. So now I want you to quickly share what is it that you're learning so far. Okay. And I'm going to pick some of the things that some I saw in the chat during the section from our first section. All right, so let's go with that. I'm still waiting for you. So let's go with that first. Okay, what do I have here? All right. Okay. Bumi said it's new to her that not only fat people can be diabetic. Yes, yes, diabetes, it doesn't, it's not looking at your size. It's not judgmental. And then say, oh no, this person is fat. Yeah, should affect how this person is slim. Okay, no, 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 that's not, that's not it. Yeah, and they are things that would lead to, like, make you be prone to it. I mean, being, Dr. Jeffrey said already that you have a black skin, it's already that's something. And if it's in your family, maybe someone has a parent, your grandparents already, then you know that, okay, I should live in my life knowing that, this is in my family. Oh. uh But it's not only fat people. You can be slim and be diabetic because it's not your size that is the real issue. It could contribute a little, but that's not the main issue. Okay. I have more. Okay. All right. It was comment to the first section. Meet demystified. Thank you, Doc. All right. I want to. I'm looking out for more comments, and if you have questions, please drop them in the chat. Drop them in the chat. I see a question, and our doctor is going to take that in a second because they are in the chat there. We have some pharmacists, we have nutritionists, we have doctors in the chat. So they are going to reply to this in a second. Okay. So Peace David has a question. Is it possible for one to be cured from diabetes at an early stage? Oh, you're talking about when the person is pre-diabetic. Okay. Then question 2, what are some of the foods that one with diabetes should and shouldn't eat, please? Yeah, thank you all doctors. Yes, I'm pushing it all. All right, for the food, we're getting to that. We have a nutritionist. We have a section, a presentation from a nutritionist, and that's like the 5th presentation. Okay, that'll be coming up soon. And for the question number 1, I'm going to allow the experts to answer, and you're going to be getting an answer in the chat soon. And once that comes up, I'm going to come back up, and then I'm going to take the questions and take all of the answers. Okay. But if you have more questions, please put them in the chat, and I want to know what it is that you are learning so far. All right. So now we are, how many of us, let's do this thing quickly now. Drop a fire emoji if the sections so far have been enlightening. Yeah, drop a fire emoji if the sessions so far they've been enlightening. You learned something new, something blew your mind, something that you didn't know about. You learned something, you discovered something. So comment section, fire emoji. I want to see the fire
Good
emoji.
evening.
I want to see the fire emoji. All right, fire emoji, fire emoji, fire emoji, and drop all your questions. So I'm looking at all of them, and I want to see the fire emoji. If you're learning something, okay, I have a fire emoji here. Yes, I have another one here. Okay, I have a question here. All right, how can you get tested for diabetes? Okay, so here's the thing. There is random blood sugar test, and then there's fasting blood sugar test. Okay, so you would go to the random, means like you showed up at any random time of the day, you ate already before coming, so that's really not accurate, right? So what you would do is pick a day, go to the hospital, a primary health center, and then go there fasting. That's what one of the things Dr. Jeffrey had mentioned. You can take your breakfast with you in your bag. Don't eat it, though. Don't eat it. Don't eat it. When you go to bed, by let's say you go to bed around 10, you ate your last meal maybe by 8 or 7 p.m. thereabout. Now, because you are sleeping, you don't have to eat again until you wake up. So when you wake up, don't eat anything. That will be fasting blood glucose. All right. So test. So you now go to the hospital in that state without eating or without eating. You go there, and then they do a test, and you tell them that you want to. You can just say you came for a diabetes test. Just you can let the nurses know. Just tell them that. Okay, and then that you've not eaten. So, yeah, and they take it up from there. Okay, so, and then our doctors are in the chat. Like I said, okay, we've got an answer already. Uh, Dr. Raphael is in the chat, and he gave an answer to Peace. So let me read it. All right. So thank you, Peace, for the question. We talk about remission in diabetes and not a cure. So there's no cure, there's remission. All right. Remission is achievable, especially if the person is committed to dietary and lifestyle changes. So remission is that you come to a point where your blood sugar level, the reading is stable. It's not, because there's times where it spike. It's like above normal, like way above normal. And it's bad. It's bad. You don't want to get there. You don't want to be living your life at that point. Okay, so you can bring it to bring your numbers down to a stable level, but that doesn't mean that it's cured. Yeah, it means that your lifestyle change is helping you maintain it where it should be. Okay, so Dr. Raphael is recommending dietary and lifestyle changes, and that's what we're preaching here on this section today: lifestyle modification. In our lifestyle, it involves you exercising, moving your body, eating the thing that goes inside of you, because the truth is that we are what we eat. Okay, so the things that go inside of you, very important. If you can do that, you're able to, while taking your medication, you can drop it to a normal level. But it's not like you are cured. It's not like you, because you now get to the normal level, you now stop taking your medication and stop living the life and just go back to your old ways. The sugar, your blood glucose will rise back. As you return to your old ways, it will return back to the normal reading. Okay, so um if you have any other question, I hope that was helpful though. If you have any other question, please put it in the chat. Okay, thank you, Dr. Vidapo. We really, 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 really appreciate you. Thank you for doing this, being here and being in the chat, taking your time. We appreciate you. Please, everybody say thank you again and appreciate him, please. And now we are moving this. We're moving this ministry to permanent site. Yes. All right. So our next speaker she is a pharmacist, and we will be talking about medication adherence in the management of diabetes. Okay, so she's a young pharmacist passionate about helping individuals make informed decisions through evidence based health information. She is also an advocate for a better healthcare system where healthcare professionals are nurtured to thrive and serve. Oh, that part is very important. Okay. So, ladies and gentlemen, a round of applause. Drum roll, please, as we welcome Farm Chidima Obi as she take us on medication adherence in the management of diabetes. All right, please let me see those claps, the round of applause, the drum. Let me see them. I know the chat has few minutes delay, but let me see the clap, okay? Let me see you clapping, see you appreciating her as she takes us to the next, actually the next level we're going to now. We're moving, we're progressing. All right. Oh, I see them coming in. Great, great, amazing. All right, let me get out of your way.
And welcome to Cocoa Mills City virtual event on diabetes. And this is just a way to close up the month, all right? This is still one of the days or in the year that we usually celebrate the World Diabetes Day, all right? And thank you so much, and shout out to our host, Farm Esther. She's just a friend, a colleague, a sister, like a whole lot more. And it's actually a privilege to be on this platform to talk about this and also to share my ideas and the information I have a little about medication adherence in diabetes. All right, and this is very important because for any patient that is being diagnosed of diabetes, you really have to be educated about the drugs you are on, because we have had a lot of patients coming down with relapses and complications just because they didn't take their drugs or because they didn't adhere to it strictly. All right, so don't log out of this. Stay tuned. You will really learn one or two things. Even if you're not a patient, you should be a caregiver, a relative, or a friend. Or who knows, you can be beneficial to a diabetic patient someday. So stay tuned and let's do this run together. We're going to be talking about medication adherence in the management of diabetes, and I'm privileged to be a pharmacist, so trust me, I'm going to give you good information on that, all right? And so the first drugs I believe most diabetic patients, or if you have someone who is diabetic, you should always know that there is a deficiency or there is an issue with the insulin, pancreas and all. Well, I'm not going to bore you with a lot of medical jargons, but I'll try as much as possible to bring it down to your level, irrespective of what level you are. All right, so the first common drugs that people always know about any patient that is on diabetes is insulin, all right? Because we are always assuming that insulin is that hormone that is deficient, right, in diabetic patients. Although not all diabetic patients, this is usually more observed in type 1 diabetic patients. And I believe the speakers would have done justice, or other speakers would do justice in talking about the different types of diabetics we have, all right? We have the type 1, we have the type 2. Right, and there is another one that also a lot of people are very familiar with. If you're a caregiver to a diabetic patient, I guess you might know this. That's metformin, right? And it belongs to the class of the biagonites, all right? And we also have, for example, I have a pack to show you. I believe you should know this, or you might have seen this before. Glucophage, all right? That's like a very good brand that is done. I'm not here to market brands, trust me. I'm just here to show you some of the drugs that we have in the treatment of diabetics. And there are a lot of classes. We have up to 7 classes of that. So I've mentioned about the insulin just in a different class on its own. All right, we also have the biagonites that I've mentioned. An example of that is metformin, all right? And we also have the sulfonylureas. Example of it is glimepiride, we have glyburide, and this is just an example, all right? You can see the name, glimepiride, all right? We also have the thiazolidinons. We also have the DDPT, but let me not bore you with those. But these are the classes of anti-diabetic drugs we have. And so depending on the stage of your diabetes, because most times we have the pre-diabetic stage where the patient is still having symptoms of that, but have not really started having a very high spike in their sugar level. So depending on that, your endocrinologist might have to place you on metformin. That's just a monotherapy, all right, just to help to reduce your sugar levels. But at some point, depending on the progression of your disease, if one of those drugs are not able to control your sugar levels, there might be need for them to add 1 or 2 other classes of drugs. All right. So I'm explaining all this so that you understand that the reason why they're adding extra medications, if you're here and maybe you are diabetic and you're taking more than 1 medication and just asking why all this, and maybe sometimes you decide to take one and leave the other. No, the reason for those is because they all do the same thing, although they have different mechanism of actions, which I'm not here to bore you on. But because of their various different mechanism of actions, you're able to combine them together to get an effective result. All right, so this is very important, and it's very important you adhere to your medications, and that will be what I'm talking about, or what I'm already talking about. So it's very important. And just like I explained about the metformin and all, you've been given that. So depending also on the level of your sugar, your progression, there might be times you might have to increase from a higher strength, or from a lower strength to a higher strength. So these things are all adjustable, all right? So if you're here and you have you're a caregiver and all, and you're familiar with some of these drugs I've mentioned, you can put it up on the comment box. Which one are you familiar with? You can tell us about it. And I would also like to talk briefly about the side effects of some of these drugs. Yeah, some of the classes of anti-diabetic drugs, like the biagonites. Okay, the biagonites do not cause hypoglycemia, all right, because their effect actually is to cause hypoglycemia. But we have some classes causing more hypoglycemia than the others, all right. And also one like, I think the thiazolidinons, all right, they have an adverse effect of weight gain. So some classes actually cause that weight gain, all right. You can also put it up on the chat box. If you actually been experiencing any side effects about you, feel free to let us know about it, and I can explain more on that. Why I don't want to talk so much about these drugs is because my main focus is on the reason why you have to adhere on these drugs. Okay, so, and let's go further to talk about if I don't take these drugs, or if I've been placed on these drugs and I don't adhere to them, or I don't take them as I ought to, what are the implications? Yeah, because there is an implication. Okay, and so if you're like me then don't like taking drugs, even though I'm a pharmacist, if you're like me and don't like taking drugs, please, you have to be aware that this actually has serious complications if you don't take your drugs, and so you need to. So let's go on to the next topic. What would be my fate if I don't actually take my diabetic drugs? Or if I'm here and I'm having diabetic symptoms, you're having, and possibly, especially for those who possibly have had their relations suffer from this. I'm a Christian, I believe in God and all, but there's what we call hereditary sickness, all right, or disease. And the importance of science, or the reason why these things are being put in place, is also for you to be aware, all right. So most people have their father, grandfather, mother, siblings, or uncles suffer from this same disease. It's very important that you start early on time to check out on your disease, because it has to do with your metabolic rates, all right. So diabetes is actually a metabolic disease, so you have to start early to actually find out, do I have this, or are there possibilities that can come down with this? The reason for asking those is to enable you stay above it, because it can be avoided, right? Yeah, it's also something that can be well managed, and you can live long even having it. And you must not necessarily be on drugs, all right? And this is why Cocoa Muse City is here, because honestly, I'm an advocate for people to actually learn to actually manage or prevent diseases with their diet, all right? And that is one of the non-pharmacological means we actually bring to you on the table when you are diagnosed or you have pre-diabetic symptoms. Okay, so I'm saying all this to say that my section is not just an important section, but other people are going to talk about your dieting, your food, and your exercise. It's very important, because this is what helps you stay above diabetes or live above diabetes. And you might be saying, okay, is this what I wanted to tell you? Yes, this is part of what I want to tell you. The reason is because if you're able to stay above this, you're able to avoid the complications that come with diabetics. All right. And if you're already a diabetic patient and you've not been on your drugs, honestly, I want to plead with you, for the sake of your loved ones, for the sake of your life, and for the sake of not passing through that pain, you really need to take your drugs or your medications seriously. And apart from your medications, your other lifestyle modifications very seriously. All right. So what is your fate if I don't take my drugs seriously? What would happen to me? There's what we call the macrovascular and the microvascular complications of diabetes, or can also say the chronic and the acute. All right. And the chronic complications, which most people are much familiar with, is that you can come down with retinopathy. Retinopathy has to do with having your nerve damages, your eyes, like the eyes damaged, that's the nerves connecting to the eyes, all right? Because diabetes does a whole lot with the nerves, all right? And that is why if you're a diabetic patient, you realize that at some point you might start having some weird feelings on your feet or your nerves, or your tips of your hands or the tips of your legs, all right? That is because of the nerves, the flow of blood, because most times when you have a raised blood sugar level, it can affect your nerves, and this can reduce the supply of blood to those endings, all right, those peripheral endings. So you can come down with retinopathy, that has to do with the nerve damages of the eye. You can also come down with nephropathy, that has to do with your kidneys, all right? And this is very important, and this is very critical. You wouldn't want to pass through that just because you didn't take your drugs as you ought to. All right. And there is one that is very common. Like, I literally see patients come in there while I worked as a theater pharmacist, and my heart bleeds, because we literally had patients coming to the hospital to have surgeries. And those surgeries has to do with, you look at their diagnosis, and these are type 2 diabetic patients. And possibly most time when you go down through their medical record, you realize that these patients have not been on their medications, or they have not been taking it frequently. All right. The third one is actually the foot problem. Most people call it diabetic foot problems, and can come down as sore, ulcer, and it can lead to gangrene if those ulcers and sores does not heal. All right, this is because, just like I explained earlier, your nerves are already damaged because of your raised sugar level, and because it's poorly controlled, you can have yourself coming down with those issues. All right, and for this gangrene, I must beg you, please, if you're a diabetic patient, please learn to communicate to your healthcare provider when you start experiencing any form of sore. Don't take it lightly. Try as much as possible to allow it heal. I've literally seen people in their 30s, people in their 20s, 40s, and 50s, their leg cut. Like, I literally had this patient that he came to the hospital with just a toe. Like, he had a sore on the toe, all right? And he kept on managing it, but he was not really adhering to his lifestyle modifications, all right? And he was not really constant with his drugs. By the time he came back to the hospital, they saw had already grown and they had to cut off the leg. By the time they cut off the leg, like, sorry, they had to cut off the toe, like the ankle, from the ankle, like that. That's the feet, all right? And by the time they cut that off, there were a lot of complications that came in. There were a lot of like sepsis, like the wound got infected and it took a while for it to heal. And before you knew it, it has already spread to the upper part of the leg. All right, guys, so let's talk about how or what are the factors. So just like I said, I can relate so well when people have issues with not being able to take their medications and all, because we experience that on a daily basis in the hospital setting. So, but I believe there are still ways to work around this. This is because I believe strongly, for one thing, that most times there are some external factors you cannot control, but there are factors within that you can control. All right, this is very essential, especially when you know that you can't afford. So let's talk. Number one, I believe that is the reason is patient-related factor. According to WHO, there are like 5 reasons why there are issues with adherence. One is patient-related factor. All right. Another one is social economic factor, and that's where cost, financing, affordability of those drugs come in. Another is condition-related factor, and that's where patients have like other comorbid diseases, treating this, treating that, and all, and possibly has a lot of medications to take and can defer or not be able to adhere to their medications. All right. Also, another can be therapy related. When you have polypharmacy, that's like, sorry, I'm using big language. That's like when you have like a whole lot of complex regimens. For example, I told you earlier that we have like 4 classes of diabetic drugs, and a patient who is on diabetes or whose sugar level is poorly managed can be on 2 to 3. All right. And these are the real issues. These are like the real human problems we're facing every day, and people like what's the solution? And the social economic factor, honestly, it's actually across board, especially in Nigeria, where we have a lot of issues with the inflation and price of drugs are increasing every day. I look as if the common man can no longer afford that. But I really want to really encourage us to understand that, for example, we have a drug, metformin, and you know, a lot of people have been used to a particular brand and they feel like when they switch to another brand, will it really work? And honestly, I've not taken all the metformin brands, so I cannot tell you this one works and this one does not, right? But there are actually cheaper brands of metformin, all right, that you can get. So I actually encourage my patient. The first thing I always tell them is, especially when they have a problem with, now we're already talking about how to solve it, so I'm talking about the challenges and how to solve, so just catch up with me, right? Especially when you have problems with, okay, I used to buy this, but I cannot afford this. Can you get to talk with your physician? And I always advise, please, if you're a diabetic patient, don't just have a family doctor. I know you can have a family doctor that maybe treats your headache, your malaria, all, but this is a specialist disease, or like is a condition that actually requires a specialist. So even if you have a family doctor, also ensure that you have someone that is an endocrinologist. All right, these are the people that are in charge of that area. It helps you so that when you're having issues with, I can't afford this, are there alternatives, and then they can walk you around it, so that you don't just second guess. Another thing I will also encourage, don't just go to a pharmacy or a chemist actually to just say, I want to buy BP sugar drugs just because your sugar levels are increasing. No, make sure you see an endocrinologist first, all right, before you start taking your drugs. Just like I was saying, there are some economic factors that you can't control, but there are ones you can control, and that is why, just like I said, I've always been an advocate for you to actually stick more on your lifestyle modifications, even while on your drugs. All right, you can imagine a person that is trying to manage their sugar levels, they're still eating some of the food that a diabetic patient should not eat, or they're eating it in large portions. All right, these are things that you have to understand that, okay, my body system is actually coming down with this condition, and so I have to adjust. All right, so like I said before, if you are one of those patients that possibly you are on 2 classes of drug, for example, let's say you're on glimepiride and you're also on metformin, all right, instead of you buying these 2 different drugs, you can actually buy one that contains both glimepiride and metformin. Do you get? And in that way, it actually saves convenience. So in that way, you are tackling polypharmacy, you're tackling the complex regimen, you're also tackling the cost. All right. And for example, this is another class of drug that has metformin and sitagliptin. It has two classes of drug just in one. So it's easier for you to take, easier for you to remember. It's also easier for you to actually afford. All right. And just like I said, there are different brands. This is just another one that has metformin and sitagliptin. All right. So these are drugs that you can always have their combinations, and it will save you the stress of having to buy two different drugs or two different brands. All right, just in trying to treat one disease. And also I will encourage that if you have an endocrinologist, please let them know that this is what you're suffering from. Although there are sometimes that it's very hard to change the medications, especially if you're on insulin, because there are no alternatives to insulin, especially if you're a type 1 diabetic patient. All right, and that is why the honest truth is that, and I know most medical professionals, or let me not say most medical people, can tell you that, but the best bet of you trying to manage your diabetic condition, especially at the early stage, is to work very strictly on your diet. If you're able to do that, it will save you a whole lot. It doesn't mean that there are some cases that people are lucky enough to be able to reverse it permanently, but some people, they're able to effectively manage it, not having to take a whole lot of drugs, not having to increase, because you see some patients that are taking metformin, from there they have increased the strength to 2 grams. That means they're taking 4 in a day. From there they have to add another class, just because they're having poor management. But if you're able to adjust your diet, adjust your lifestyle, and just put in other lifestyle modifications, which the best bet for you to go to is Coco City. She's your advice on that. Honestly, my area of interest is not so much on diabetes. So if you know anything about your diet, how do I adjust it, how about portions, you can see a whole lot of things online. You see some people tell you don't eat this, eat this, don't eat this, eat this. But the honest advice I always give people is that there are substitutes. All right, anytime someone is telling you don't eat this, also ask them, then what should I eat? Because these things are actually created, and they have one thing they can supplement and complement to your well-being. All right, I believe that these things can be adjusted. There are portions, and also there are some that you have to eliminate entirely. But in most cases, you don't have to eliminate them entirely. You just have to adjust your portions. And that is why you need a nutritionist, or you need someone that is cool in that. All right, to help you understand that. So this is me just trying to encourage you guys that it's possible for you to manage your diabetes. It's possible for you to live healthy. It's possible to having diabetes is not a death sentence. It's possible for you to live healthy, take your drugs, have your medications, also adjust your lifestyle, and live your fulfilled life. So let me round up, because other speakers are coming on board to also talk about diet and all right. So but I want to encourage you that if you're here and you're having an issue with possibly affording your medications just because they are much or because they are costly, there are truly other affordable medications that are also in the same class that you can afford. Stick to them. Don't feel like, okay, because it's not a superior brand, it can work. Most times they actually do work. It's just our psychology. All right, stick to them and ensure that you work closely with your endocrinologist and also your dietitian to be able to help you afford that. I already have one here, which is Coco Milk City. She's my #1 vendor. Once I just say diabetic patient that is stressing me with your diet, I just say go there. So if you're here and you have issues with your diet, oh yeah, all right guys, I love you so much, and I hope you enjoy the rest of this section. Do have a great day, and see you soon. Bye.
Okay, a round of applause for Farm Chidima Obi. All right, everybody in the comment section, bring it. I want you to bring it. I'm seeing people saying great job, Farm. Farm Esther is even here in the comment section. So Farm will be delivering gems. Okay, please bring it. A round of applause. Bring it. I'm waiting. There's 10 seconds delay, so I'm waiting. I'm waiting for the claps. Say thank you. And the thank yous, I want them to start coming. All right. Thank you, fam. Chidima Obi. Yeah, thank you, thank you. I want to see all the thank yous coming in. Say thank you, thank you, thank you, thank you, thank you. Okay, I see a thumbs up. Yeah. I see a thumbs up. say thank you. And yes, if you have questions, please drop it in the chat. We have pharmacists in the chat. We have doctors. We have experts. So please drop it in the chat if you have any question. And yes, please help me appreciate pharmacist Chidima Obi and say a big thank you to her. Okay. All right, everyone, round of applause. Big thank you. I'm waiting for them. It's coming up. I see a question. We are getting to it in a second. Farm Esther is in the chat. Yeah. So I'm going to ask her to take that question. She's going to take that question. So let me read it out. Okay. Let me read that part out and let me know how was this section or how has it been so far? How's the event been so far? Has it been worth your time? Has it been so far? Has it been so far? How has it been so far? Let me know. How has it been so far? I know I can see the chat. It's the few minutes delay. So yes. Okay. Let me know how has it been so far and say the thank yous in the chat, appreciating all of our speakers so far. And we love you. Thank you so much, Pharmacist Chidimaubi, for bringing it. Okay, so now I'm going to read this question here, and there's going to be a response in the chat. Okay, we have Pharmacist Esther. All right. There's the question, let me read it quickly. It said, this from Gift James. She's asking, what would be the long-term effect of switching your medication to a lower one due to cost, knowing that in the long run the risk, oh my gosh, outweighs the benefit? Okay. Okay. The yes, Farm Esther is in the chat. She's going to answer the question. Okay. And as soon as she answers it, I'm going to read the answer. Okay. So, but Farm Chidima actually talked about that too, about um it's not like you're switching to a lower one. That's not what she said. She's talking about, there's we have generic names of medications, then we have branded names. So you could have one medication, but then you have like two, three, four different brands that are producing that medication. Is That's why as I was saying, there's a generic name and then there's brand name. So when the doctors write, most of the time, like 70%, 80% of the time, when they write prescription for you, they write generic names, except there's a particular brand that, like, okay, this brand, do I trust this brand? Then they will write that brand for you so that you buy that particular brand. So what from Chidima B, what she's saying is that if this particular brand that is expensive, you go to a good pharmacy, okay, qualified pharmacy that you know that they have quality medication. The reason why I'm stressing this part is because we Okay, I'm back. Sorry, I had a little technical issue, but I am back. And while I was away, the reason why you couldn't hear anything was because I went off for a second. Yes, I live in Nigeria. All right. So the question we have here, we have uh answers. Okay. So let me share the answer in a second. And someone is saying thank you for the question. All right. So let me share the first answer. Okay. Let me know if you can hear me. My light went off, and so my Wi-Fi and my MiFi are all trying to do work. So confirm that you can still hear me, all right? Because I'm back on. Okay. So we're answering the question that Gift asked, and this is from Pharmacist Esther. It's Pharmacist Esther that is answering this question right now. And she said, so in switching medications, a patient doesn't single-handedly switch medications. He or she would work hand in hand to achieve a common goal. That's you work hand in hand with your doctors to achieve a common goal. The goal of the therapy is to achieve the therapeutic effect. Okay. So let's read the second part of it. Medications are only switched on doctor's recommendation, and there will be continuous monitoring regardless. All right. So that's what pharmacist Esther is saying. Okay. So you don't like simply because you're having financial issues. I know we live, if you're in Nigeria, it's a lot going on. Drugs are becoming more expensive. Like sometimes they are not just two times, like twice the price. Some it's like four times the price of what it used to be. So if you're having that kind of issue, meet your doctor and let them know that okay, here's what's happening, and is there any way, so maybe there is a different brand, it's the same medication but it's a different brand, and that brand has like a cheaper version, like they are not, it's not expensive, yeah, and maybe you can switch to that, but you have to ask them, no, don't do it yourself. Okay, so I hope that that um that question that answered it. All right. Uh, let me know. Okay, and if you have more, you can ask it in the chat. All right. But we had a little network issue, but we are back, so you should be able to hear me now. All right. You should be able to hear me now. So please confirm if you can hear me. Please confirm in the chat if you can hear me. All right, please confirm in the chat if you can hear me. I'm still here. Please confirm if you can hear me. So I can hear you, or an emoji in the chat. Let me know that you can hear me. Okay? Let me know that you can hear me. Let me know that you can hear me. Confirmed. All right. So you can hear me now. Okay. So I'm trying to type it out that we had little technical issue because there's few seconds delay. All right. So because there's few seconds delay, you are a little behind. Okay. So I think this is from Chidima Obi. Okay. So you got an answer from Chidimobi, and she said, you must ensure to inform and work alongside with your endocrinologist before switching or reducing your dose, knowing fully well that the implications are worse. Okay, so you do not, for whatever reason, don't change the dosage of your medication yourself. It has to be an expert that said, okay, you're doing okay, maybe let's drop it. Or the numbers are not so good, let's increase it. Okay. Not don't make a decision yourself. Do not, for whatever reason, make a decision yourself. All right. So, Gift James, here is your answer, and I want you to let me know in the chat if the answer, if you're still not satisfied, okay, if that's clear, and if that's good enough, okay, or if you need a little bit more. Yeah. So you can find Dr. Chidima, you can find her on Instagram, and that is the handle. You can find her on Instagram. That's her handle. So you can follow her, and then you can get to learn some more. Yeah. So okay, now I'm hearing you can't hear me. You can hear me. So let's try this again. Can you hear me? Give me a thumbs up if you can hear me. Okay? Give me a thumbs up if you can hear me. Give me a thumbs up if you can hear me. Give me a thumbs up if you can hear me. All right? Give me a thumbs up if you can hear me. Okay. Give me a thumbs up if you can hear me. I'm trying to type in something, type and talk at the same time. I can see some thumbs up, thumbs up. Okay, thumbs up. Okay, so we had a little. Okay, you see, now let me rewrite that. Okay, yeah, let me rewrite that. So we had a little tech issue. Because this is what happens when you're trying to type and talk at the same time. I'm using the same side of my brain and it's not working. I thought I could multitask, but so we had a little tech issue, but we are back. Please refresh your live stream. Okay, please refresh the live stream. All right, I think this should be correct now. Yeah, let's see if the English is correct this time around. Okay, we had a little tech issue, but we are back. Please refresh the live stream. Yes, I think that's grammatically correct now. All right. Okay, so drop a fire emoji if this section, I want to hear from you. How has the section been so far? How we have had 3 sections. How has it been? Okay, how has it been so far? Let me know in the chat. Let me know, has it been worth your time? Has it been worth it? Has it been worth it? If you still have any questions, please put it in the chat and let's know. All right, I'm seeing thumbs up here. That means that you can hear me. All right, and then if you can't, please refresh the live stream. All right, refresh. I'm seeing more thumbs up. Okay, so please refresh the live stream. All right, now we are moving on to the next section. Okay, please keep it coming. I want to hear how has the session been so far, what have you learned, all of that. I want to hear it. But while we do that in the chat, I'm going to just read the bio of our next speaker. It's a very short and sweet section, and you're gonna love it. Okay, so it's not easy having to live with a chronic disease, right? Eventually it takes a toll on you emotionally. It just becomes draining, and then you just wake up, you're just down, and it's just a lot. Yeah, and this year, the theme of this year World Diabetes Day is diabetes and well-being. The well-being actually was referring to like your emotional well-being, your mental well-being. That's in addition to, the physical well-being. They were making emphasis on the mental and the emotional part because it studies has shown that people with chronic disease, that impacts and just affects them emotionally, and some people struggle with depression, anxiety, and just all of that. And for this event, we thought about it and said, okay, let's bring in someone that would talk to us on that topic, just something really short and sweet, just to encourage you. We see you, we feel you. We may not understand completely all of your pain and your struggles, but we do, we see you, okay? And we kind of get it. And we know it's not easy, and we are rooting for you. And that's why we have this section to encourage you, yeah, uh, to see maybe the bright side, look on the bright side, and just find the good in your life and in every day, and how to manage, how to cope, yeah, with the emotional impact of dealing with a chronic disease like diabetes. So we have I'm going to read her bio, okay? So she is an internal medicine resident based in Germany. She's greatly motivated and driven by the desire to create impact wherever she finds herself. Besides medical practice, she's passionate about building Daily Doctor, a platform dedicated to fostering and advocating for the wellness and well-being of medical doctors around the world. She enjoys traveling, writing, and sharing inspiring content on her social media platform. Ladies and gentlemen, please help me with a round of applause to her. Drum rolls, please, and help me make welcome Dr. Lucinda as she talks to us about coping with the emotional impact of diabetes. Okay, so let me see the clap, the drum rolls, the fire emoji, all of it. Bring it in the comment section. Clap, 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 clap. Let me see them I'm seeing the clap. I'm expecting more claps, more drum rolls as we welcome Dr. Lucinda to the stage as she takes us in this section.
I am a medical doctor and an internal medicine resident practicing in Germany. Due to my area of specialization, I am constantly in contact with diabetic patients, and these patients spend a huge part of their life or sometimes their entire life having to deal and cope with the physical and emotional impact of a chronic disease like diabetes. So today I would like to share a few strategies which you can adapt into your day-to-day activities to help you cope better with the emotional impact of living with diabetes. Number one, education. Whether you've been recently diagnosed or you've lived your entire life with diabetes, learning more about the condition, the different ways it affects your body, and how you can better manage it gives you the confidence and the power you need to make healthier decisions each day, which in turn has a positive impact on your mental well-being. The second strategy will be self-compassion. You need to practice self-compassion, self-care, self-kindness. The same grace you extend to others, extend that same grace to yourself, mostly on the low days, because there will be high days and there will be low days. On such days, you need to spend time engaging in activities that bring you joy, such as listening to music, watching movies, or even going out with friends. The third strategy will be having a good support system around you. This can range from friends to family and having support groups and communities, a safe space where you can share your experiences and listen to the challenges of other people living with diabetes. This informs you you're not alone on this journey. Number 4, it is essential to regularly participate in physical activities that bring you joy. This could range from sports like basketball to football and other activities like yoga, hiking, and dancing. Activities like this greatly enhance your mood, and your mood in turn plays a vital role in how you take care of yourself. Lastly, it is essential to intentionally create a habit of gratitude, such as having a gratitude journal where you can periodically document the things you're grateful for. This act not only helps you shift your mindset from dwelling on the negatives, but also helps you focus on the other positive aspects of life. I hope by implementing these few strategies, you would have equipped yourself with coping and dealing both with the physical and emotional aspects of living with diabetes. See you next time, and I wish you all the best.
Okay, please help me appreciate Dr. Lucinda for that short and sweet section. Okay, you can find her on social media, and if you can find her on social media, she's on Instagram. All right, you can follow her there and learn more. She creates really nice and great content, and Jelly Doctor is a page that is for doctors advocating for their well-being and their wellness. So if you're interested in that, you can follow her on Instagram. All right. So we are going to the next level. Okay. And quick, you let me know if you can still hear me. Okay, because I still see the comment section. People saying they can't hear me. Sorry, we had a little issue, but if you click on the refresh, there's a live button where you are live on Instagram. You can see live. If you click on that live, you would be able to catch up. I hope they see this. Okay. Has a section so far. Yeah, has a section so far. Say a big thank you to Dr. Lucinda in the comment section for me, please. And as we welcome our next speaker, all right, and I'm going to read her bio. Remember that the chat is live. If you have any question, feel free to drop it in the chat. We have the experts in the chat, and they'll be there to answer your questions. Okay, so we are almost done. We have, after the section, we have one more section and we are done. All right. So now we are going to the nutrition part of things. Okay. And I'm going to read our speaker's bio quickly. All right. She is, how many of us are excited about this section? All right. So Becky Ike is a registered dietitian nutritionist, healthy food creator, and advocate for healthy water. She's a wife and mother to two wonderful kids and lives in Lagos, Nigeria. Becky has a strong passion for helping individuals and families achieve their health goals through personalized dietary nutritional plans. With expertise in gut health management, diabetes management, hypertension slash hypotension, children nutrition, and weight management, etc. Becky Ike provides evidence-based guidance and support to assist you on your journey towards a healthy lifestyle. So, ladies and gentlemen, a round of applause, please, as welcome nutritionist Ike Becky Ijoma as she takes us on the topic of diabetes and nutrition.
Everyone, good morning, good afternoon, good evening, depending on where and when you are watching this video. My name is Ike Becky Ijoma, a nutritionist, dietitian, healthy food creator, and healthy water advocator. And today on the program, I'm going to discuss the topic diabetes and nutrition, eating healthy for diabetic management. As we all know, diabetes is a chronic condition that affects the immune system, enabling the body to properly regulate blood sugar. And there are three known type of diabetes: the type 1 diabetes, which is autoimmune, insulin dependent diabetes, and the type 2 diabetes, which is lifestyle related insulin resistance. Then we also have the gestational diabetes, which occur during pregnancy. All of these three diabetes, they have causes, and one of the major cause of it is poor nutrition. Yes, poor nutrition, um, um, sedentary lifestyle, lack of physical activity, obesity, um, excessive weight gain. It could be autoimmune, um, environmental causes, yes, viruses from environment and other environmental triggerers, and also um, it could be genetic when from the family history when there's a history of any of this type of diabetes, a person is prone to having the condition, and also age and ethnicity. So these are the common causes of diabetes. Are there complications? Yes, there are complications ranging from heart disease and kidney disease, nerves damage, which is neuropathy, aside that eye damage, which is retinopathy, then also depression and amputation, because um, among the symptoms of this condition is wounds, sores that don't heal. And this sore come with so many discomfort and pain. So the medical solution to such sore is to amputate, to cut off the part of the body that has such sore. And also other symptoms we can look out for: excessive frequent urination, excessive hunger, excessive water intake, um, obesity, unexplained weight loss, fatigue, blurred vision, and the likes of them. Now, this condition, they have something in common. Nutrition is what connects all of them, apart from other nutrition is one big factor that plays a key role in the prevention help us grow and to be well, to be healthy. And now, if we are looking at from the nutrition standpoint of what we should take and what we shouldn't take, let's now focus on what we should take to help prevent, manage, and reverse diabetes. We want to look at for gut-friendly food, gut health-friendly food. These are food that are whole, high in fiber, and low in glycemic index. Fermented food, we have a lot of them. For whole food, we have grains, and whole grains are grains, cereal or pseudo cereal, that has its bran, its germ, and its endosperm intact, as opposed to refined food that has only the endosperm intact. And we want to look at this grain that are whole, especially the ones we can find in our local markets here in Nigeria. We have millet, the millet family. They are one fantastic. They are gluten free, and they are high in fiber and vital minerals and nutrients. We are looking at the millet pearl, which is a gray color millet, the finger millet, which is also sorghum or guinea corn, fonio, which is acha, the foxtail millets. These are 4 millets available in our market. And we can also look at corn as well. They are high in fiber, but corn and wheat, I'll talk a little bit on them, just the little negative side of them. I won't call it little because they react negatively to some people. For corn, some people, because corn is high in mole count, it affects some people's respiratory organs, like it affects the sinus, and it also affects thyroid hormone secretion. It also causes bloating, sleeplessness, serious constipation, that it affects the guts. So we want to just monitor our body whenever we eat and see how our body reacts to food. So we want to take note of all this. We also have rice, the black rice, wild rice, red rice. Here we have our local brown rice. We have father rice, although it's not quite refined as the so-called foreign rice. We should stay away from all those refined rice that are so common in the market. They are high in glycemic index, and they don't have any fiber much fiber in them, and they are so starchy because they are highly refined. We want to stay away from them. And next on the list is legume. Granite is part of it. We can eat our granite raw when we soak it. We can cook it. We can add it. We can cook it with our brain, eat with sauce and vegetable sauce and stew, and we enjoy it. And we also want to stay away from beans that are high in glycemic index, the honey beans and sugar snap beans. We want to go for black beans, black-eyed beans. We want to go for azuki beans, which is also called the small kidney beans. We want to go for lentils. We want to go for mung beans. We want to go for chickpeas. We want to go for green and brown peas. We want to go for lima beans and pigeon beans. They all have tremendous health benefits. We also want to look at our vegetables we have here. Ugu, water leaf, senti leaf, utazi, uziza, ewedu, okra, garden egg, carrot, tomato, tatashi shombo, atarudo, shoko, efotete, moringa, and this leaf called hospital tufa iyanokbaja. Do you know that moringa yamapada, you can use it to make your soup, egusi soup, sesame seed soup, soya bean soup. You can use it, add to your sauce, to your stew, to your porridge, to your beans, to your salad. You can make tea out of them. Then we also have the tuberous vegetable, yam, water yam, cocoa yam, sweet potatoes, yellow, butter, red, purple, and also carrots. They are also tuberous vegetable. Um, Herbs like gentlemen, good morning, good afternoon, good evening, depending on where and when you are watching this video. Legume, granite is part of it. We can eat our granite raw when we soak our rice. We have further rice, although it's not quite refined as the so-called foreign rice. We should stay away from all those refined rice that are so common in the market. They are high in glycemic index and they don't have any fiber much fiber in them, and they are so starchy because they are highly refined. We want to stay away from them. And next on the list is legume. Granite is part of it. We can eat our granite raw when we soak it. We can cook it. We can add it. We can cook it with our grain, eat with sauce and vegetable sauce and stew, and we enjoy it. And we also want to stay away from beans that are high in glycemic index, the honey beans and sugar snap beans. We want to go for black beans, black-eyed beans. We want to go for azuki beans, which is also called the small kidney beans. We want to go for lentils. We want to go for mung beans. We want to go for chickpeas. We want to go for green and brown peas. We want to go for lima beans and pigeon beans. They all have tremendous health benefits. We also want to look at our vegetables we have here. Ugu, water leaf, senti leaf, utazi, uziza, ewedu, okra, garden egg, carrot, tomato, tatashe shombo, atarodo, shoko, efotete, moringa, and this leaf called hospital tufa iyanokbaja. Do you know that moringa iyanokbaja, you can use it to make your soup, egusi soup, sesame seed soup, soya bean soup. You can use it, add to your sauce, to your stew, to your porridge, to your beans, to your salad. You can make tea out of them. Then we also have the tuberous vegetable, yam, water yam, cocoa yam, sweet potatoes, yellow, butter, red, purple, and also carrots. They are also tuberous vegetable. Herbs like turmeric, ginger, and also we have vegetable like beetroot. We don't want to take away the skin because most of the nutrient lies on the skin. All we need to do is wash the dirt and cook them. And also we have fruits, our fruits here too. We have our local apple, pear, avocado pear, guava, cashew, orange, mango, cherry, which is a agbalumo. We have a tangerine, oranges, lemon, grape, that the one that is red or the colorful one inside, big orange like lime. We have pawpaw, we have pineapple, watermelon. We should take advantage of this fruit when they are in season. We can do the foreign one too, like the grape, the black, the red, white grape. We should go for those with seed in them, so that we can benefit from the resveratrol. They have it more than the one that are hybrided. Then we can as well do berries, blackberries, strawberry, cranberries, boysenberry berry. We have all these berries dried. We can also do the dried ones. We have kiwis dried. If we see the fresh one, plums, prune, we can do them. Apples, we can enjoy them when they're in season. And now I want to touch on nuts, the healthy fats. Healthy fats, talking about fat and oil, not the oil, the common oil in the market that are highly refined and filled with chemicals. I'm talking about our palm oil. Our palm oil can withstand heat. It's one of the blessings we have in this country that we don't even know the value. We can use it for stew, soup, rice, eat it raw with cooked yam, add onions and pepper and your spice and eat it. Then I'm also going to talk about ghee. Ghee is a fat from cow milk. It's one healthy oil that has vitamin B12 intact, and it can withstand high heat as well. Then avocado oil. Then other oils that are healthy like coconut oil, our granite oil as well, coconut oil, olive oil, the cold press. They cannot withstand high heat, but but we can add them to our salad, we can stir fry with them, we can take them raw, especially the olive oil and coconut oil. So then we are talking on also the nut and seed. We have a nut, like I said, we can do, although it's legume, but we can do it raw. We have cashew nut, we have walnuts, we have tiger nuts, date palm, we have pumpkin seed, we have flaxseed, chia seed, we have sunflower seed, we have macadamia seed, we have nuts, macadamia nuts, pecan nuts. We are talking on also the nut and seed. We have a nut, like I said, we can do, although it's legume, but we can do it raw. We have cashew nuts, we have walnuts, we have tiger nuts, date palm, we have pumpkin seed, we have flaxseed, chia seed, we have sunflower seed, we have macadamia seed, we have nuts, macadamia nuts, pecan nuts. We should take advantage of these nuts. They are rich in omega-3 and 6 fatty acid, healthy fats, and they're also rich in protein and fibers. So we should take advantage of all of this. I also want to talk about herbal teas. We can use our lemon orange peel for tea, ginger, turmeric, and all the spices I've listed before. We can use them for our tea, scenting leaf. We can make teas out of them. We know we are not used to teas in this part of the world, apart from the normal beverage, we know Milo and Bonvita. Now these teas contribute greatly to our health. We want to also take advantage of them. I also want to talk on food preparation method. Like I talk about tuberous vegetable that has the nutrient of the skin. You don't need to peel it, you wash and cook. I also in other food preparation method, the kind of cookware we use in cooking. What metals are they made of? You can check on Google, is your cookware killing you? Then you get more information on that. You want to go for surgical stainless steel that helps to preserve the nutrition in our food when we cook, because we can use them to cook on medium heat and not high heat. Also, I've talked about fat and oil. I also want to talk about rest, and we need rest. For we women, we need to sleep between 8 to 10 hours. If we have that luxury, please, we should take advantage of it. We need the sleep because on a monthly basis, we have different type of hormonal changes that occur in us. So we need the sleep to help our hormones work properly. Sleep is important. And also, exercise cannot be overemphasized. 30 minutes a day, 5 times a week of walking alone does a whole lot. We don't need to go to gym if we cannot afford that. We can use our house. There are so many exercises we can do at home that will benefit our health. I also want to emphasize on taking in sun. We need to go under the sun every day, at least 10 to 15, 20 minutes. It's very much okay. The best way we get vitamin D is by exposing ourselves to sun. That is the natural vitamin D. And the benefit of vitamin D cannot be overemphasized, because vitamin D affects so many organs in our body. It helps this organ to function properly. And lack of vitamin D has been associated with so many health challenges, including diabetes. So we want to take advantage of that. It is not true that when we expose our skin to sun, we get skin cancer. No. It is when we expose our skin to chemicals from cosmetics and poor nutrition that can lead to skin cancer. So let's take note of that. And another thing I'm talking about is water. We should avoid taking dead water that are acidic. Majority of the water out there, they are acidic, just as acidic as our car battery. They are so dead. They don't offer anything to the body. But rather, we should go for waters that have life in them. They are bubbling forth with life. Waters that are hydrogen rich, ionized, alkaline, and antioxidants. When we take this water, they hydrate us very fast. Hydrate our brain. We see it working on our skin, it having much impact on our health, helping with blood sugar regulation. So this water are valuable too. We need to go for healthy water. So in a nutshell, we see that nutrition plays key role, crucial role in preventing and managing and reversing diabetes. Let's take advantage of all of this. Thank you.